Dr. Fahmi Farah is on board, and she is one of North America's most recognizable names in cardiology. And, Doctor, it's really great to have you back on the radio. And let's talk a little background about you. Of course, you're in the Dallas-Fort Worth area. What do you do?
Hey there, it's great to be back on your show. I am Dr. Farah, invasive cardiologist, CEO and founder of Bentley Heart Medical Center, and also director of Global Healthline Foundation.
Okay, very good. Thank you very much for joining me on the program. And was speaking just a little while ago with an oncologist, somebody that specializes in dealing with colorectal cancer diagnoses and things like that. And she was mentioning that she's seeing more young people coming in at an alarming rate. The disease is the second most common cause of cancer deaths on a nationwide basis. Colorectal Cancer Awareness Month is March, of course. And want to do a follow-up with you when somebody is maybe undergoing certain types of cancer treatment, say, could be for maybe lung disorders or colorectal issues and things like that. I would have to imagine that puts a lot of pressure, a lot of stress on the heart. Is there a correlation there?
There certainly can be. You're absolutely right. Chemotherapy, especially chemotherapy and radiation, they can both have an impact on the heart. You're right. It can put a lot of strain and stress on the heart. There are certain types of chemo drugs that can particularly have direct impact on the heart and can actually cause heart failure. And those are more common among patients with breast cancer who are undergoing certain types of breast cancer chemotherapy. Also, head and neck cancer, like any type of radiation that you're receiving in that area that's close to the heart, which of course includes breast cancer and head and neck cancer, as well as lung cancer. Those folks can have direct impact on the heart as well. Of course, certain drugs can cause heart failure, but the radiation can accelerate the plaque buildup process as well, and these patients can down the road contract things like coronary artery disease and blockages in the heart faster.
When you mentioned that when you're treating somebody, say, with a certain regimen, say chemotherapy is going to be introduced into that regimen, is that done on a gradual basis just to determine whether the heart can withstand that kind of situation with new medicines being introduced? Is it a gradual phase in other words, to protect the heart with chemotherapy?
It depends. Usually those are dependent on the cancer stage, type of cancer and what stage the cancer is at. And of course, certain drugs, they do require a baseline echocardiogram, which is an ultrasound of the heart to make sure to see where the heart function is at baseline and if that person will be able to tolerate the chemotherapy. And you're right, gradually as the chemotherapy is in process, we will do subsequent chemotherapy, echocardiogram, just to keep an eye on the heart to make sure it's not dropping too much. And yes, we do have a critical number we follow. If the ejection fraction drops, which is a number we calculate how strongly the heart is squeezing, if that number starts to fall, particularly below 40 to 45%, we typically hold that drug, the chemotherapy drug.
And interesting that when you mentioned that involving certain types of medical regimens or chemical or medicine regimens, in other words, you've seen a lot of great success stories come along the way in the last 5 years, right? Good stuff.
Oh, absolutely.
Yeah, and from the standpoint of that, and again, it's important to follow up on that specific regimen. And, Doctor, one of the last things the doctor that was on previously talked about things like heart disease, how there could be maybe a little correlation, say, between certain cancer diagnoses and the stress that it puts on the heart. And when you're looking at maybe some of the secondary disabilities caused by, say, ischemic heart disease, could that be things like sleep apnea or maybe, you mentioned heart failure, or maybe valvular disease? Does that come into play as well with all that?
It can, yes. Sleep apnea is a great one to talk about because sleep disturbance has now been designated as one of the major risk factors for cardiovascular diseases like coronary artery disease, like you mentioned, ischemic heart disease, which is usually due to blockage building up in the coronary arteries of the heart. And so, yes, those people who have sleep disturbance, sleep disorders like sleep apnea, they definitely need to get that checked and treated, because otherwise it can certainly accelerate that heart disease.
My goodness, Ken, the sleep apnea also at the same time creates, I think it's called atrial fibrillation. Do those two go hand in hand?
There's a great correlation between sleep apnea and atrial fibrillation. In fact, sleep apnea can cause all sorts of arrhythmia. There are many different types of rhythm problems that the heart can have, and atrial fibrillation is one of the common ones that can be that people can get as a result of sleep apnea. Or, those who have sleep apnea already and also have atrial fibrillation, uncontrolled sleep apnea or untreated sleep apnea can worsen that condition and make their heart rate go up and AFibs be out of control more frequently.
Okay, absolutely. And describe for the listeners and the drivers out there, Doctor, what this feels like. And I'll just preface that by saying I've had that, and it is an awful feeling. I was able to get cardio converted, I think is the phrase for it, and thankfully a normal sinus rhythm. But what does that feel like for, say, the average person? Say a driver listening to this, is it where their heart is fluttering and then it beats and then fluttering again? How would you describe it?
Yeah, so a very interesting question. I'm so glad you asked. So for those who have atrial fibrillation, there are actually two types of patients and presentation. One, they will be symptomatic. Like you mentioned, they'll feel a sensation of fluttering in their chest, like they can actually feel their heartbeat. And sometimes it feels like a racing feeling because their heart rate is fast. It's going really fast. They can feel lightheaded, dizziness. They can also have fatigue. Fatigue is the number one, the most common symptom we hear about from patients who have atrial fibrillation. Now, there's another set, like the other half, they will not have any symptoms at all. And so the atrial fibrillation can go undetected for months to years. And these are the folks who usually show up with a stroke, because one of the biggest risk factors with atrial fibrillation is having a stroke. And if it's not caught and treated on time, then those people are at highest risk of getting a stroke.
Okay, goodness sakes. And in a stroke, what is that? Is that almost like maybe a vein popping or exploding kind of a scenario? What is that? What is a stroke?
There are two major types of stroke. One is a hemorrhagic stroke. That's the one where, literally a blood vessel will pop in the brain, and it's called a bleeding stroke. So it'll bleed into the brain, and that's a stroke. But the most common type of stroke is actually what's called an ischemic stroke. It's not a blood vessel popping and bleeding. It's basically a blockage, something that's blocking blood flow to the brain in a certain area of the brain. And that's where atrial fibrillation comes in, and that is the ischemic stroke is what atrial fibrillation causes. And the reason that is because people with atrial fibrillation, the top chamber of their heart doesn't squeeze properly. It kind of quivers when they're in atrial fibrillation. As a result, blood kind of stands still. And anytime blood stands still, it'll clot. And so they have high risk of forming blood clots in the heart. And the heart is a pump. It'll squeeze that blood clot out of the heart, and it'll go into the brain and cause, that's called an ischemic stroke, because that blood clot will clog up the blood vessel and blood flow will stop, and that will cause a stroke.
My goodness, what a fascinating part of the body, the heart. Doctor, when you are, or maybe somebody listening that maybe they're noticing, say, some swelling in the ankles or in the feet, many drivers lead a very sedentary lifestyle. They're driving federal regs 11 hours a day, 14-hour duty cycle, but when they maybe lie down for the night to go to bed, they might see swelling in the feet area or in the ankles. Is that a sign that could be maybe a heart issue that could be developing?
Yes, swelling in your legs is a very common sign for congestive heart failure. So if you're having shortness of breath and swelling in your feet, that needs to be checked by a physician.
Okay, all right, very good. Doctor, we got a break. for the commercial. So hold on. Dr. Fahmi Farah is on the line with his driver. See how all of this is interconnected. If there's something going on in one part of the body, it's certainly going to be maybe causing an issue in another part of the body as well. That's why you got to talk with your doctor. Remember, you are your best advocate out there on the road. No one's going to speak up for you unless you do. So call in. Have you ever had atrial fibrillation? That's a cardioconversion procedure, and that's where the doctors literally stop the heart and hope that maybe that natural rhythm will kick in, and you're going to be good to go. And it's all about the trucking industry, supply chain. We want to make sure that you guys stay healthy and safe out there on the road, and doing the best you can to stay in front of it day after day. And we're doing that with the help of Dr. Fahmi Farah on board with Bentley Hearts. And Doctor, again, thank you very much for joining me on the show. And I'm looking on your website, and there's a lot of great information there. That I'm looking at a story that it's reading ischemic heart disease, chest pain, and blockages. Now, my golly, that's a lot of letters there. Explain what that means. The blockages, ischemic heart disease. What is that?
Yes. So ischemic heart disease basically means that you have blockages in your heart that are significant enough to cause blood flow obstruction, enough to where when you're doing, exercise and things like that, like a little bit heavy activity more than your usual activity, you'll start getting chest pain or symptoms of shortness of breath, things like that. That's ischemic heart disease. And the worse the blockage is, like as time progresses, the worse the blockages become, the worse that ischemic heart disease becomes, and the worse your symptoms will become. And eventually, even with regular activity, you'll start getting symptoms, and sometimes even at rest, you'll start getting symptoms. So that's the gist of what the definition of ischemic heart disease is.
Okay, absolutely. And, when you look at heart disease overall, is that kind of like a broad term? In other words, can you narrow it down even further with certain platforms? Like what are some of the types of heart disease in women? What are your thoughts here in women?
Yeah, so women are equally as likely to get heart disease as men. And in fact, several studies have shown that women may even get heart disease sooner than men because due to high blood pressure, which is one of the biggest risk factors for heart disease, the negative impact of that actually affects women at an earlier stage. So they start getting that damage earlier on. Heart disease, as you mentioned, ischemic heart disease, which is blockages, can affect women as well. Women can have heart attacks. It's still the #1 cause of death for women. And then heart failure, which is the pump, which is the main function of the heart. The heart muscle can get weak over time due to various reasons. Blockage is the #1 reason for that to happen. So congestive heart failure is one. Congenital heart disease that can affect both men and women. Rhythm problems, like we discussed earlier, atrial fibrillation, all sorts of rhythm problems can affect women as well. One thing I'll mention that is very unique to women is called peripartum cardiomyopathy. This only happens in women and women who are pregnant or shortly after delivery. This is a type of heart failure that impacts women in that period as a result of pregnancy. And the prognosis can be very good if it's caught on time and treated on time. But if it's not, then the prognosis could actually be pretty bad, and the mortality is very high associated with it. We're seeing more of this now in the United States with increased maternal age and risk factors, of course. So those are some of the key things that can impact women.
Okay, very good. And as far as like some of the other symptoms when it comes to maybe recognizing or identifying heart disease in women, would that also mean like the pain in the arm, left or right, lightheadedness? Would heartburn be part of that as well? Those three factors.
Very good question. So we're talking about acute heart attack. So a heart attack can present differently in a female compared to a male. A lot of times, females will not have any chest pain at all when they're having a heart attack. As you said exactly correctly, they will have indigestion-like symptoms, nausea, sometimes vomiting, and sometimes just fatigue. So those are called atypical signs of heart attack that are more common in women. Males can have that too, but it's more common in women.
Okay, very good. And say, doctor, that somebody's going in maybe to get their DOT physical or maybe just for a regular routine examination. If they're experiencing any of these things you're developing, would it be a common procedure, practice, maybe to do an echocardiogram on someone right there, connecting the electrodes, in other words?
I would think so, especially for somebody who has risk factors, family history. They should get a simple cardiac evaluation, which is, EKG, and of course an echocardiogram would give a lot of information about the structural integrity of the heart.
Okay, very good. Doctor, thank you very, very much for joining me on the program. Always great information. And again, drivers, ladies and gentlemen listening out there, it's important for you to be very proactive. Take the bull by the horns here. Just don't think of this in terms of, well, I'll do it tomorrow, I'll do it next week. Next week's going to turn into next month, and then it will turn into next year. And the most important thing out there on the road today is you, ladies and gentlemen. So if you're experiencing any kind of chest discomfort, maybe there's some heart history that you need to maybe tell somebody about, get into the doctor and let them take care of you. Your primary care doc's going to be the first one, and then probably a referral on to a cardiologist, and you will be in good hands if you're in the Dallas-Fort Worth area with Dr. Fahmi Farah on board. And, Doctor, thank you very much for joining me on the show. Hey, one more time before I let you go, Doctor, website, social media, where can folks find you?
Thank you so much for having me. Always a pleasure to be on your show. You can find me at www.drfahmifarah.com, also on social media, Instagram and Twitter at Fahmi J. Farah.
Outstanding. Doctor, next week, thank you. And we'll talk to you then. It's Dr. Fahmi Farah